Hi, I'm Nancy Lindell, Public Relations for Mission Health. We're here today to do our weekly COVID update. I want to remind viewers who may have experienced a loss of insurance due to job loss or other circumstances that we are offering an insurance assistance hotline. You can visit our website at missionhealth.org, and there's a red bar at the top that has all of our COVID-19 information on it. And within there, you'll find that toll-free number with professionals who will help walk you through getting new insurance or what your choices are and how to navigate those. So we're here today again with Dr. Hathaway, our Chief Medical Officer here at the North Carolina Division of HCA Healthcare and Mission Health. And Dr. Hathaway, the numbers in the state are rising, and that is what is on the top of people's minds right now and the concerns that go with that. What can you tell us about what's happening in the state of North Carolina?
The state reflects, to some degree, some of the national trends, Nancy, and I think it's important to understand that state trends in the context of what's happening nationally. We've heard repeatedly that the South, particularly 3 or 4 different states, South Carolina, Florida, Texas, and the West, California, have seen an increase, a pretty substantial and significant increase, not just in the number of cases of COVID-19 that are being diagnosed, but also, and perhaps more importantly, the number of patients who are being hospitalized with this illness. The rises of these cases is dramatic in Florida and Texas, in California, to the extent that some of the hospitals and health systems have gone back to limiting their non-COVID type care, cutting back on what we had previously referred to as non-essential services in order to handle the demands of the COVID patients who are in their facilities. If you've looked at our numbers, which have been heavily publicized recently, we've seen an increase also. These are reflective of what's happening in the state. The state numbers of new cases have been rising, and the total hospitalizations within the state this week has been as high as it's ever been. That being said, our numbers are relatively small. Our numbers in the Mission Health System are relatively small in comparison to the numbers that we've seen in other states. We're not at capacity with respect to our beds. We have ample capacity, both in our step-down beds and our intensive care unit beds. We have ample capacity with our ventilators, as we have talked about before, and we have adequate PPE and testing at this point in time. The concerning thing to me, and I think to all of us, is that we don't know where we are on the curve. We talked so much early on about flattening the curve, and we don't know if this curve is going to continue to rise or if it will taper off in the next week or two.
So when we talk about the curve, and if you look at it from the beginning, things have been relatively flat here.
I think we have to go back and realize what strategies kept the curve flat before the recent increase. And those were community isolation, self-isolation, minimizing contact with other people unless absolutely necessary. And at the time we had the more stringent stay home, stay safe orders, with many of the businesses actually being closed. But we can, in the context of having more mobility, we can still be really smart about it. We can choose where we go and when we go there, and how we go there. So when we get out in the public, it's critically important, and we've said this many times, that we not forget to wear our masks, that we distance physically. I know the word has been social distancing, but when we're socially together, we must try to maintain physical distance to decrease spread of the virus, and then that we are hyper attentive to washing our hands. My personal anecdotal experience has been that in the last week or so, it seems like mask use in the community has increased. There has, of course, been the Buncombe County ordinance that anyone in a public location indoors must be in a mask. And so that, I think, is sound advice, and we should take that into our personal lives, whereas if we're gathering with friends and family in small groups, we should be mindful of being far apart as much as we can, and then wearing masks when we're close together.
And I have my mask here, which isn't cloth or it's disposable. How long can I wear that?
I think when you think about how we wear our mask, the duration of wearing it, that is, how many days is a mask good for, depends on how long you're wearing it during that day and how dirty or soiled it gets in the process of that. We don't have hard cut and true guidelines about when a mask has lost its ability, but I think if we encourage people to use common sense, that's a good idea. If you're wearing a cloth mask, wash it on a regular basis, keep it clean, and keep your hands away from the front of the mask when you're using it. When you're taking it off, make sure you take it off from the earpieces and you avoid touching the front surface of the mask as much as possible. And then for the paper masks or the disposable masks, if you wore a mask for 20 minutes a day, you could wear that for many, many days. If you wear a mask for one day for 6 or 7 hours, you may need to change that after a day or so. Common sense, look for structural integrity of the mask, look for soiling on the surface of the mask, look for moisture on the inside of the mask.
We've learned this past week from Governor Cooper that the school systems will be opening. And what we want to maybe talk about today is the health issues that come with learning from home and with going back to school. And what advice can you give parents about safety measures from a healthcare standpoint?
We fully appreciate that there's anxiety around the school openings. We all have anxiety as we move forward. As we get closer to that time, we'll be sure on our websites and through our Facebook page to provide guidances as best we can on how families and their children can prepare for that event in the fall.
I've recently read that there have been some vaccine trials and some of them seem to have been successful. I know we're in the early stages, but can you talk about what's going on there?
Sure, happy to do so. As I've said before, we will be in our new normal, who knows, the normal keeps changing, once we get to the development of a vaccine. Those trials have been ongoing for some time, and that will create widespread immunity in the community, which will allow us to resume more normal interactions. That time frame is uncertain, it remains uncertain, but the trials to get us to the vaccine are progressing. We recently received some early data from one of the trials that documented quite clearly that we can get an antibody response. The goal of a vaccine is, when we administer the vaccine to humans, is for us to develop antibodies. Those are the proteins produced by our white blood cells that fight off the virus and neutralize it, so it either minimizes the infection that we have or prevents it altogether. We have early data now, some really good data that suggests that they had a robust antibody response with one of the vaccines, and so it's moving into the next phase of trial in late July, where there'll be a phase 2, where they'll be administering that vaccine to more people. Phase 3 will be large-scale trials, hopefully by the end of the year, perhaps in the beginning of next year. And then we will watch anxiously for two things. One is efficacy. Is the vaccine working? Does it prevent infection? And number two, safety. Does it lead to adverse outcomes for people who get the vaccine? In general, in the United States, vaccines are very, very safe, but they're very safe because we do rigorous testing and follow outcomes in patients with those vaccines. We have to make sure that our COVID-19 vaccine is safe too. But we're very encouraged by those results released this week.
And I was also looking at the news stories about people who think that, wondering if once you've had COVID-19, if you've been infected and you've recovered from it, can you get it again?
It's a really interesting question, Nancy. I'd like to say definitively that the answer is no, but I don't think we know at this point in time. Our understanding of the biology of vaccine infections and viruses is that once you're infected, at least for a short period of time, hopefully for lifelong time, as the case is with chickenpox as an example, you develop an immunity to acquiring that disease. There have been a number of different case reports of people who have tested positive and then later on have tested negative, followed by a subsequent positive test. And we're not entirely sure whether that means that they've reacquired the illness or whether they're still shedding the virus in perhaps a non-contagious fashion from their initial infection.
There's also been a lot of conversation in the community about testing. How long does it take? Where can you get tested? And talk to us about who we test here at the hospital and also where there are testing sites in the community.
Yeah, the testing, as people remember early on during the pandemic, I guess we're just about 4 months into it, almost to the date, in terms of real activity in our own community. It was about mid-March when it started. One of the biggest limitations that we had was availability of testing. It took us over a month before we were actually able to do testing in-house at Mission Hospital, and we were reliant on the state labs and other labs commercial labs throughout the state to get our test results. That situation has changed for the better. We are getting increasing availability of supplies and reagents so we can do in-house testing, but we still don't have such ready availability that we can do widespread testing of anybody who wants to be tested. At Mission, when you come, we test people who have a high clinical suspicion. So if you come to see us in our emergency department, our clinics, and you have a high clinical suspicion for COVID, meaning that you've been symptomatic and had, or an exposure, a high-risk exposure, then we would consider testing you. We are not doing testing of every patient that is admitted to our facility at this point in time. That's for two reasons. One, the guidances nationally and statewide don't suggest that that's important to do, partly because we have limited availability of testing, and number two, when you test a lot of people who have low risk of having the disease, it's not very helpful in how we manage patients. However, we are testing patients who are potentially going through a high-risk surgical procedure, and so we have an algorithm that looks at who you are, what your individual characteristics are, whether you're at risk based on exposure or being in a vulnerable group to be a high-risk person for having the disease. And then we look at your procedure and whether it involves aerosolization of, that's getting your products, your saliva and other material into the air. If you're having a procedure that involves your upper respiratory tract or GI tract, then we might put you through a test prior to you having the test.
And then for those in the community who are just looking for testing sites, I believe that the county health department has a list on their website.
The county does, and most of the clinics now, if you go to any of our clinics or go to the county websites, they'll test you if you fit into one of the appropriate groups. I want to caution people. Unfortunately, still in our limited availability, many of these tests are sent to commercial labs, and with the push, we are seeing increasing number of tests being done each day throughout the country and throughout the state. With this push for increased testing, is stressing and stretching a little bit the capacities of some of these labs, and so the turnaround times, the time from when you get your test to when you receive your results, is not as rapid as anybody would like. And we've recently seen that some of the commercial labs who had turnaround times of under 2 days in the past are now rising, sometimes 3, 4, 5 days. And so just caution people. It's unfortunate that that's the case. As more labs come up and more capacity comes up in the existing labs, those turnaround times should drop.
So the news has been prevalent on several states in our country, California, Texas, Florida, how their numbers have risen. What can we do here in North Carolina to get back to a flatter curve?
Yeah, I think the lessons that we've learned as we've had our conversations over the weeks, one of the things I've tried to emphasize is that we've benefited by being behind most other communities or many other communities in terms of the wave of patients that have hit us. And I think what we've learned is that they had, those states in particular, had one thing in common, which was an increased move or a more rapid move to an opening of their economy. And if you look at the shapes of their curves, that it correlates almost 10 days to 2 weeks after the opening of their economy that they've seen the rise in cases. I think for us, as we try to get back to a new normal, that the lesson we should learn is to be cautious as we do so, and we be really attentive to the 3 W's again. Wearing a mask while out in public, 2 people wearing a mask in communication with each other, the transmission rates are very, very low. So that's the most important thing. Staying as far apart as you have to in order to be able to minimize that droplet interaction between people, and then again, hyper-attentiveness to washing your hands. And then again, going out when we need to go out as opposed to going out when we want to go out will do a lot to allowing us to both heal ourselves, decrease the number of cases, and heal our economy, which we know is suffering.
Dr. Hathaway, thank you again for joining us today. We'll be back next week with more information on COVID-19.